Hello everyone and welcome to Kenya O'Clock News and Real Talks, where we break down the nation's biggest stories. Today's episode dives into the heartbreaking reality faced by many new mothers across Kenya, women detained in hospital over unpaid medical bills after childbirth. We explore the recent act of compassion by Mike Sonko, who cleared the bills of 110 mothers at Mama Lucy Kibaki Hospital and uncover the deeper crisis behind this gesture, highlighting the struggles, human stories, and what the government can do to end this cycle of suffering once and for all. Today, hundreds of new mothers held in hospital wards, not for medical reasons, but for debt. On Tuesday, November 4, former Nairobi Governor Mike Sonko stepped in and paid the outstanding bills for 110 mothers who had been detained at Mama Lucy Kibaki Hospital, settling roughly 1.6 to 2.0 million shillings so those women could finally go home. But this one-time rescue exposes a deeper recurring crisis across Kenya. Women who give birth, sometimes by emergency cesareans, sometimes after losing their babies, being kept in hospital beds because they can't pay. Viral reports and hospital statements in recent weeks show similar scenes at Thika Level 5, Moi Teaching and Referral, and other public facilities where dozens, even hundreds of mothers have been stranded over unpaid maternity fees. What's driving this? Health financing in Kenya is under strain. Many mothers lack active social health coverage or have gaps in their registration. Hospitals face cash flow pressure and, in practice, sometimes use detention as a way to recover costs. Advocacy groups like Kenyan have repeatedly called on the government to stop the unlawful detention of patients and to clear arrears, arguing that detention violates human rights and endangers mothers and newborns. The human cost is enormous. Imagine new mothers cradling fragile newborns while worrying about bills they cannot pay. Imagine mothers who had cesarean sections, procedures that carry higher costs, unable to return home to recover properly. Imagine families missing income while mothers are stuck in wards. These are not statistics. They are lives disrupted, dignity eroded. So, what can be done? Here are practical, evidence-aligned solutions policymakers should act on now. 1. Enforce a ban on detention and fast-track legal protections. Clear, enforceable national rules with oversight and penalties must stop hospitals from holding patients for inability to pay. Advocacy bodies should be empowered to monitor compliance. 2. Close gaps in social health coverage at point of care. Ensure immediate SHA, NHIF registration and verification at admission so eligible mothers aren't denied discharge for paperwork or lapsed enrollment. Mobile registration kiosks and same-day activation can prevent trapping patients in wards. 3. Compensate facilities to remove perverse incentives. The government should accelerate reimbursements to public hospitals and provide bridge grants for uncompensated maternity care so facilities aren't driven to recover costs through detention. Pilots of an emergency maternal hardship fund would offer a safety net while claims are processed. 4. Scale up free maternal services and target subsidies for high-cost cases. Expand free maternal guarantees for C-sections, neonatal emergencies, and bereavement cases coupled with transparent reporting so resources reach frontline wards. 5. Community-level safeguards and accountability. Strengthen county grievance desks, rapid response social workers, and legal aid partnerships so families can resolve arrears without prolonged confinement. Mike Sonko's intervention freed 110 mothers today. But lasting change won't come from one-off philanthropy. It must come from systems, finance, law, and compassion working together. If Kenya values its mothers, we must build a health system that keeps them safe and lets them go home with dignity. This has been Kenya O'Clock, bringing you the stories that matter most. Stay tuned and stay informed.